name is Reagan. I'll be your nurse here for the rest of your stay. So I have some doctor's orders to discharge Miss Laura.
Awesome.
And so I'm just going to go over some paperwork so we can get you out of here as quickly as possible.
Perfect.
Miss Laura, can you give me your name and date of birth? Laura Smith, 10/16/04. Okay. Perfect. Okay. So, you have this new issue, the myasthenia gravis, and you have some new meds that you're going to be taking when you go home. So you're going to be taking, it's called Mestinon, and so what we gave you IV in the hospital, we're going to give it to you by mouth.
Mm-hmm.
So you're going to get extended release pills, and you're going to get like regular release pills. So the extended release pills are going to be the higher dosage because they're going to last her throughout the day. That's going to be like 180 to 540, just depends on her. And then she's going to get several doses of a 30 to 60 milligram pill throughout the day. It just depends on her symptoms and how she's feeling. So some of the signs and symptoms of this that you want to take note of is some stomach cramps, diarrhea, increased secretions, a little bit of nausea and upset, and then some muscle twitches. So if those get too much, call your provider.
Okay.
And then we're also going to give her some prednisone by mouth. You want to make sure she takes that with food, and then she's going to be on a low dose, 15 to 20 milligrams. And I would take that in the morning because it does cause kind of like insomnia. So it's better to take that in the morning. And also, it is an immunosuppressant, so it's going to decrease her ability to fight off infection. So I would have her stay home, avoid crowds, make sure she gets an update on all of her vaccinations. And it also may cause some GI bleeding sometimes. So the doctor also prescribed her a proton pump inhibitor that helps decrease stomach acid to reduce the occurrence of like an ulcer or GI bleeding. And then also prednisone causes hyperglycemia, so it's high blood sugar. So I have here an order to get a glucometer, so that's where she pricks her finger. And then puts it on a little strip, and it reads her sugar. So we want to
do that throughout the day.
Yes. It may cause her a little bit of weight gain, but that's okay. You can just monitor that. If she gains more than 2 pounds in a week or 5 pounds in a month, just alert your healthcare provider. So some of the complications that may happen, it's called myasthenic crisis. So basically it's just, she came in really weak and fatigued and her muscles were weak. So this is just like a higher level of that.
Okay.
She's gonna have, if she gets really high heart rate, she can't move her muscles at all. They're just flaccid. So if like it just drops, like she doesn't have any control. Or if she's really pale, that is a medical emergency. You want to call 911 and go to the hospital. That can happen if she takes too much of her medication. So what I'll have you guys do, set an alarm for the time that each dose is due so that it reminds you, oh, take this dose at this time every day. Because if you do an early dose of that, it goes into another crisis called the cholinergic crisis. That's where she has too much, it's like too much secretions, and she starts twitching, and her pupils get really small. So if that happens too, call 911, go to the hospital, medical emergency, and then don't skip any doses or double up, and take them as ordered. You want to keep her meds with her at all times. So if you guys travel, just keep it in the luggage close to you. If she does work, then keep some doses on at work. And then also she'll need to have a medical alert bracelet. That just lets any emergency personnel know what she has now, because with the RA and the myasthenia gravis. If there's an emergency, you want to make sure she gets the accurate treatment. And then with myasthenia gravis, there's a lot of fatigue. So you want to make sure that she does activities that reduce fatigue, so a lot of rest periods in between. And don't take any over-the-counter medicines unless you've talked to your provider, because sometimes those interact with her mestinon pills and her prednisone. So you want to make sure that is good. If she does start to not be able to swallow as much, there is a liquid form of the mestinon that we can give her, and you want to take that 30 minutes to an hour before meals. I forgot to say that. Let's see. And so I'm also going to give you some resources for a speech therapist, a physical therapist, and an occupational therapist, just to help her with that muscle weakness and keep her range of motion good, and as well as speech to help with like the swallowing and the dysphagia, because there's really no cure for this. So as the disease progresses, she may get worse with like swallowing and stuff because the muscles are weakening. And so the doctor put in a referral for like a speech person, and she may go home on oxygen later in the disease, but right now she's doing pretty good. Also, we want to talk to her RA doctor and see if we can't change some of that medicines. I'll have a paper in here that explains all that so that you can give that to her doctor, and it's in her records as well.
Perfect.
Other than that, everything seems to be in order. I'll have you sign for her since her hands are a little weak and her fingers are a little weak, and I'll go ahead and have you sign. Don't worry about the date and the time. I'll take care of that for you. All right, and I'll have you get her stuff ready once your car is here. Just let us know. We'll take off the monitors and oxygen and get her wheeled down.
Perfect. Thank you, Reagan.
You're so welcome. Call light's right there if you need anything. Let us know, okay?
Will do. Thank you.